A veneer is it's a custom-made dental restoration that's permanently glued into your tooth, and it's usually used for cosmetic purposes because it covers the front part of your tooth. It can change the size, the shape, and the color of your tooth. So veneers can be used to cover discolorations that are untreatable with bleaching. It can be used to enhance the size of teeth. It can be used to make the tooth bigger so that it hides gaps, and it can cover cracks. So traditionally veneers are made out of porcelain. Porcelain's really nice because it's very translucent, and it's made in a lab, so you kind of know what you're going to get. We can do a mock-up and pick out shapes and sizes beforehand. But we can also make them in the chair with composite material, so that's the same material that we make your fillings out of. It's a little bit cheaper, but it can look pretty nice in the right hands. Veneers should last anywhere from 5 to 10 years, but I've seen them last longer depending on how you take care of them. Because they're so thin, they are more prone to chipping and breaking than a crown. When planned well, a veneer can be very minimally invasive. We can preserve a lot of the tooth, but the downside is sometimes we do have to remove a little bit of the tooth structure in order to make room for a veneer. Another downside to veneers is that they do require maintenance. They only last about 5 to 10, maybe 15 years if we're lucky. And so when patients get veneers very young, they are committing themselves to maintaining and replacing those crowns.